Okay, three, two, and one, filming here. Hey, everybody, John Malanka here with United Patient Group for the MCRAA, which I'm proud to be the moderator for an upcoming event. The MCRAA is the Medical Cannabis Research Advocacy Alliance. It is a physician-led, patient-focused, multi-stakeholder coalition which seeks to educate patients, policymakers, and the medical community about the crucial need to advance medical cannabis research in order to protect patients, further scientific knowledge, and realize the full potential of the evidence-based medical cannabis treatments can be positively impact and improve patient health as well as well-being. And today I have a guest here. I'm here with Dr. You don't like being called doctor, I'm sorry, but Kennedy Ganti. Nice having you on, Kennedy.
Thank you so much, John. It's a pleasure to be with you today.
Pleasure to have you on. So Dr. Ganti, excuse me, my apology, is a practicing primary care physician and physician pharmacist in New Jersey. He's the president-elect of the Medical Society of New Jersey. One of Dr. Ganti's roles at the Medical Society is he is the chair of the Medical Marijuana Task Force. And so, like myself, he is also on the advisory council for the MCRA for our upcoming event as well, the Medical Cannabis Advancing Research and Policy in the Modern Age, which takes place on March 13th, 2021, online from 11 a.m. to 3 p.m. Eastern Standard Time. And so we'll get that information out. So welcome, Kennedy. Thanks for being on.
Thanks for having me, John. I really appreciate being on today.
So you are a board physician. You're based out of New Jersey. Cannabis was not your lifestyle like it is for many of us. And you have a story where I know your wife, and the outcome is wonderful. She had breast cancer, but you were finding yourself not only now as a physician, but a spouse, a caregiver for your wife going through this, and someone who was in pain and doing, I would never say don't do conventional, but there is a place for cannabis to go hand in hand. And so she saw the benefits of this. And this was just recently in the last 2-3 years, in 2018, Correct, that you saw this. And with that, and I applaud you, is that seeing the benefits, because like so many patients out there and families, seeing the benefits, they've kind of changed their life, and everyone has a story. And you have a platform because of you being a physician that you can take it to the next level. FDA, a lot of this is not approved by the FDA. And so your goal is to get it out there and have it recognized from standardization to have this as a true medicine, where it used to be a true medicine since, but ended in 1937, about 83, 84 years ago. And so welcome, Kennedy. If you want to share some of your thoughts and what you'd like to see, why education is important, and go on.
Well, I think education is the first step to understanding that we have a lot of questions and we need answers to those questions, which is where, validated research, doctors, hospitals, universities, companies, the U.S. governments around the world. We do research all the time. I mean, right now we're in the middle of the COVID-19 pandemic, and research is going to help us get out of that. To really elucidate and understand, this, wonderful plant, understanding cannabis is just much more than what has already been done. I admire you, a lot of patient advocates, a lot of patients who have gone through this journey and understood the value of this medication. And many have, it saved lives, it saved families, it saved my wife's life, it saved her, it saved our family. So casting it in its old hyperbolic notions and culture are no longer acceptable. Number one. Number two, as someone who understands this, from a usage point of view for patients, and someone who I've done a lot of pain management in my 15 years of practice, and I have found medical cannabis, after I've learned really how to navigate the medical cannabis world, and recommending and suggesting strains and suggesting modalities, I've begun to understand that we need more attention, more research, so that we can give doctors and advanced practice professionals more tools and more understanding where this specifically has a place in their practice. I'm a general primary care doctor, boarded in family medicine, and I take care of adult patients. So, but I also understand that people are coming and asking for all sorts of different indications, and I have great stories of patients, from being able to come off a lot of medications, like your Xanax and your antidepressants, to patients who have kicked high dose narcotics, opiates. Keeping in mind, we also have an opiate epidemic concurrently with COVID. So medical cannabis is very, very promising. And I think with the groundswell of support in the medical community, it's time now to really put this therapeutic option through an FDA process so that doctors can bring it into a standard therapeutic option like you would for anything else, whether it's antibiotics, blood pressure lowering medications, blood sugar lowering medications. This should be every day, but in a means that are offering products that doctors can recommend and patients can expect consistency and quality with.
You mentioned that doctors can recommend. I think a lot of doctors that I talk to who are outside the cannabis industry, they're confused because one, they weren't taught about the endocannabinoid system in medical school, and a lot of these institutions they work for really don't support this plant as a medicine. And so hopefully we will be able to bring these barriers down and the stigma. And that's why I have been part of the MCRAA. And what are your thoughts about why you joined the MCRAA?
I did it largely because I believe in patients having maximum number of options,
Yeah.
maximum number of safe options. But I'm also an advocate for my fellow physicians who want to do more, want to do better, but really don't know how to go about it. And I can't blame them. I've been able to wrap my head around all the different classification systems and references to the different types of cannabis. Not all my colleagues can work in such a qualitative fashion. They need numbers. What's the dose? Great question. How
Yeah.
much are they getting per dose? Well, how much are they, tell me more about microdosing. Tell me more about, the differences between if a patient eats this versus, vaporizes it. What's the topicals effect? And while we do have some validated research,
Yeah.
it comes from international studies and patient populations that may not necessarily mirror our own, which is why we need our own research. Number one. Number two, I think academic medical institutions, which are often funded by the US government, are afraid of running afoul of federal law. And right now, I think the MCRAA's main push is to examine the not only the pharmacology as well as the use and the patient need and the physician need to understand more, but also the regulatory and political framework. State legislatures are invoking and passing medical marijuana bills as well as recreational adult use bills. So now there's a groundswell of support where the popularity of medical cannabis is outpacing our ability to research it. So that's where the MCRAA finds a unique foundational place to begin to tie all these stakeholders together and get us over the finish line, to make sure that we can bring medical cannabis into the research mainstream without fear or punishment from, say, the U.S. government.
Well said. Let me ask you, since cannabis wasn't really your lifestyle in your practice, if you weren't thrown into this like you and I were with our wives, would you turn to cannabis if your wife didn't go through something as serious as cancer?
Yes, I would have.
Okay.
In fact, I'd been contemplating on trying to be in our program for a couple of years. However, my position in primary care lends itself to a certain degree of openness that I wanted to be careful of.
Yeah.
Medical cannabis right now in the ranks of primary care and amongst physicians still remains as a medication or recommendation down the line in terms of the therapeutic workup or a medication of near last resort.
Yeah.
So, you would want to try other medications. However, while my wife's situation certainly accelerated my interest, because I had to do something about it right away, I've been prescribing chronic medications, opiate analgesics for patients, and had begun to see the difficulties with opiates in general.
Yeah.
So when you start to look at it from a therapeutic choice perspective, cannabis, in what we do know about it, is far safer, may be just as effective, more effective, and may have better long-term effects on people or less side effects than what we know of opiates. If we just put the same amount of study that we did into opiates into cannabis,
Yeah.
I think we'd have a much safer set of medications that are going to be in wider use, and hopefully help people who are in, suffering from cancer as well as chronic pain.
Well said. With our upcoming event that you and I are both involved in, who's the perfect attendee for this, and who do you want this to reach?
I would love to see, first and foremost, physicians, practicing physicians. I'd love to see medical residents, medical students, other healthcare professionals, nurses, nurse practitioners, physicians assistants, anybody who can get their hands on an invitation, please register, please learn more. This organization is full of multifaceted stakeholders, from John and the, John with your patient advocacy, me in medicine. We have lawyers, we have people who work in state legislatures, just across the spectrum, who are trying to level set and create a fair, a level playing field for patients. So I think, I think any medical professional who has the privilege of putting pen to script or press the enter button on their electronic record, I think there's a responsibility to be able to do these things. And again, the MCRA is working very, very hard to find the best and brightest in this field to advance the science of medical cannabis research and advocacy.
Education is so needed, and I always talk about it like a pebble in the pond with the ripple effects. And what you and I share here, as well as the people that attend and listen to what's going on. And you mentioned medical students. I believe the MCRA is also offering free admission online for medical students. So please, if you're a
Correct.
medical student, this is
Please, if you're a medical student, you're the future of our healthcare
yeah,
system.
yeah.
And it's oftentimes very, very effective to teach the new generation, and find that this becomes standard of practice. Me and my colleagues, we might be the current guys, but you're going to be the medical students are going to be the doctors of tomorrow that treat the rest of us. And I think I think you and I would always want safer options. And if
Yeah.
medical cannabis is a safer option for whatever we're suffering later in life, I certainly want it to be available to my doctor that I'm seeing at the time.
Well, good. You and I have a long way to go, my friend, a long way to go. And so, yes,
Thankfully, right?
yeah, yeah. So for our medical students out there, please join us. And for any, like you were talking about, physicians, nurse practitioners, medical professionals, the list goes on, and as well as patients. And we hope you join us here. And so, as mentioned, cannabis policy across the globe is undergoing seismic change. It is no longer a question if a country or state will create a medical cannabis program. It is when. In the United States alone, there are over 36 states with a comprehensive medical cannabis program, yet healthcare providers still have much to learn. So join us virtually on March 13th as we demystify medical cannabis, from reviewing the endocannabinoid system, quality, as well as potency concerns, policy considerations, and the current state of medical cannabis research. You'll gain a solid understanding of the issues that matter to patients, healthcare providers, and researchers as we work towards advancing research and policy in modern age, which is on March 13th from 11 a.m. to 3 p.m. Eastern Standard Time. Yep.
Yeah,
And
don't forget www.mcraa.org.
.org. And Kennedy, I can't thank you enough for being on and being on this board with you as well. And thanks for your time. And thank you for everyone listening. And we hope to see you on March 13th. Have a blessed
Absolutely.
day,
We
everyone.
look forward to seeing it. Thank you.